PIER stands for Partnerships in Effective Recovery, PIER, and the name came about from one of the originators of the PIER who was on our steering committee in the day treatment program, and he thought this up, brought it to the committee, and they decided to let it stand. It's a good name.
What brought me to the PIER was severe mental illness, being on drugs, self-medicating, going in and out of prisons, and I needed some help.
I did what I call going down the rabbit hole. By night, I became an alcoholic and mixed Vicodin with rum and Coke. It's a good mixture. I didn't feel any physical pain or mental by the time I got through.
Whereas before I was very secluded, I didn't trust anybody, and I was just very individualized.
I was like that myself. I was homeless for quite a few years, over 15 years. And I think that if they really want to change, the opportunity for change is here.
Not to go too in depth, but as a kid I was a very social person, and I was really most of my life very social. I started isolating, drinking a lot.
Well, I was dirty and filthy and drinking out there. Now I'm not drinking, I'm not using drugs, and the PIER Center's helped me with showers and clean clothes.
I came out of jail and I had nothing. My first time, I had nothing. Not a penny to my name, not any food in my stomach. I didn't know where to go or what to do. The PIER is the reason why I'm here, and I didn't, quite frankly, walk into traffic.
I have utilized the PIER Center working with veterans that have been identified at high risk for suicide. I bring them out there to meet with other veterans to help them develop a healthy support system.
I believe it might be the only PIER-run service in the VA. And when I say that, it's managed and day-to-day operations are handled by PIERs. Currently there is a PIER specialist who is the day-to-day director of the PIER and works with the staff down there. The staff are all veterans who have experienced severe mental health conditions. They are in their own mental health recovery, and they assist others along that path of recovery.
One of our staff members recently told me that she was working with a veteran who was very hopeless, depressed, and suicidal, and he wasn't connecting well with any other staff member. He was really having a difficult time engaging in any type of mental health treatment. And so she sent him down here, and he connected with one of our PIER Center staff members, who again is a veteran in recovery from mental illness himself. And they were able to connect, and really this staff member provided some incredible support to this veteran. And so the veteran went back and told the other staff member who referred him that he finally felt a sense of hope after coming to the PIER Center.
It's not a typical VA type clinic. Veterans do not check in with appointments. They can drop in at any time. And the service, some of the best services there are the collegiality amongst veterans who are in their own struggle with mental health issues. Another aspect that is unique is that it provides a place for veterans who are in the VA clinics to actually help others, provide service, and in so doing they come on as volunteers or as PIER coordinators, employees, and they start to develop some more confidence, skills and strength in their own, not only their own recovery, but in their ability to work and to do something meaningful and worthwhile.
The first thing is when the veteran comes in straight off the street, the first thing that we would try to find out is if he's a veteran or not, and then see where his needs are. First thing we'll ask him is if he needs a shower or laundry, and then ask him if he's hungry, he can stay for lunch, and we will get him situated with that, and then find out his immediate needs.
There are many veterans who are very uncomfortable with coming straight to a VA facility. It can be intimidating. They've had bad experiences with VAs. They have preferred sometimes to live on the street, isolate. The PIER Center is a kind of a back door to the VA and to other services that veterans who often wouldn't seek services can come to and make that initial link. I think that's a wonderful, wonderful resource for them. It also is a place where veterans who are further along in their recovery can serve, help others, and improve their own situation in doing so. In connection with that, many veterans organizations are aware of the PIER, and they actually donate resources to help with its functioning. It's become a place where several different groups of people come together to try to help veterans in their mental health recovery.
Here at the PIER Center, other than fellowship, they are able to watch TV, watch the news, use the computer to look for jobs, contact family members. They can make phone calls within the VA and outside the VA, contact their primary care providers and mental health.
The veterans that are utilizing the PIER Center are more likely to follow up with treatment recommendations and medication compliance. And I find that the veterans that are most resistant to getting treatment, if I get them hooked up with the PIER Center, then I find that their attitude has shifted and changed because of the fellowship of that program.
There is very few things more rewarding than to watch a vet that's all tore up from the ground up, coming in here not knowing what to do, how to, navigate the system, and seeing them go from just being a non-entity, not even really accepted as to who they are, and see them get housing and get their meds straight and get their doctor's appointments and get clothing and get showers and laundry done. And then to see them a couple of months later, a few months later, actually stand on their own 2 feet and go, I am a person. That is so rewarding. So much, the money isn't it, the effort isn't it. It's helping other vets get back on their feet.
Coming here actually helped break my shell.
Yeah, in general, for the guys that are out there at the VA, out there in the streets and going through a lot of mental changes, they do matter here. They mean something here at the VA. It's very important that they do come here and get the help they need, and to give it a chance. Like anything in life, you give it a chance and be honest about it, it's going to work. But you have to be honest and willing to take directions and accept change in your life.
Went through some rehab, and Renew got me here, and I was able to feel comfortable again being around people. And I came back out, I guess I would say. The real Kathy came out. The friendly, social, happy child.
But there's needs here. You could send all the homeless veterans back here, but I'm going to tell you rapidly, clothing is going to disappear, so donate. Food's going to disappear, so bring food. The help is going to be overwhelmed, so volunteer. A smile can make all the difference.
My experience with the pier is I meet a lot of homeless vets here. And not only that, being a homeless vet myself, I bring in a lot of homeless vets from the bush and from gullies, and I bring them here to the pier so they can take a shower and have something to eat.
You can feel safe here. I feel vibes is what I feel. I'm very much into feeling, you know, it's a self-defense mechanism. Emotional reasoning is what we call it, is what I've heard just called today. Emotional reasoning. And my emotions tell me that this place is safe, that there is nothing to fear here. I'm not sure how I can explain that, but emotions are powerful, and they tell you when you're safe and when you're not. Mine tell me I'm safe here.
Okay, I have 6.5 years of sobriety. I have my children back in my life. I'm a single father of 5 children. I have my baths. I have housing. You know, I wake up in the morning and I'm getting my kids ready to go to school. And prior to me coming to the pier and getting sober, and my kids couldn't read. Now we live in Fountain Valley. My kids are honor roll students. My daughter is the first African-American cheerleader at Missoula Elementary. My son is point guard for the Fountain Valley High School. Not only has the pier saved my life, it has saved the lives of my children and everyone that, you know, it has improved the lives of everyone that we've come in contact with. You know, and I volunteer at the pier because I know that it works.
It's scary at first, but it's worth the trouble.